I'm Kathryn Waldrep. I'm an OB-GYN in Dallas, Texas. I've been an OB-GYN in Dallas here for 39 years in private practice. When I finished residency, nobody actually wanted to hire me because I was a female. And there were not any female OB-GYNs at that point in time. And another female who I had trained with, she also was not being hired, so the two of us went out and started to practice. And now we have probably one of the larger all-female practices in Dallas. Initially, we would have women come in and they would be so excited that they could actually see a female because they had wanted to be able to do that. There were some women who said, well, I don't know about this. I've always seen a male, so they were a little anxious about, well, what's this going to feel like? But I think they then felt very comfortable that they were with a female. We did a lot to make it seem comfortable to be with a female in an all-female practice. When we started out, we paid ourselves a whole $1,000 a month because we were so afraid that we weren't going to make it. But you know, it just worked. And as I have aged, my practice has also aged, and I have a lot of older patients now because I've taken care of them from childbirth to menopause now. And as women age, you know, they're in that menopausal age, as am I. Menopause is actually defined as being 1 full year without a menstrual cycle. But a lot of women will start to have menopausal symptoms for up to 5 to 7 years before they actually go through menopause. So we will see women who will start to have some hot flashes, night sweats, maybe mood swings, maybe irritability, trouble sleeping through the night. They'll wake up at 3 in the morning and can't go back to sleep. All of those are symptoms of menopause. They'll start to say they're gaining weight and they haven't changed their diet, they're still exercising. These are all symptoms of menopause. And some of those symptoms will start to affect them before they actually will be a year without a period. They may start to have some irregular bleeding during that period of time. Sometimes that irregular bleeding is in the form of very short periods. Sometimes they'll have a lot heavier bleeding, so it can go anywhere from missing a period or two to having very heavy cycles. Once you're actually menopausal, once that estrogen level actually goes down, and the way we check blood work-wise for menopause is by checking an estrogen level and what's called the FSH. FSH is follicle-stimulating hormone. Follicle-stimulating hormone is a hormone that comes from the pituitary, which is up in the brain, and stimulates the ovary. When the ovary starts to shut down, the FSH, which is in your pituitary, gets higher and higher, trying to make your ovary work, okay? So if your ovary is shutting down, not making any, the FSH gets really high. So one of the tests that we do to see whether or not you're actually into menopause or menopausal is to check your estrogen level, which can be very low, like less than 5, and your FSH level, which will be very high. And that's a blood test that tells us you're menopausal, even if you're still having an occasional menstrual cycle. That being said, once you are menopausal or you're having these menopausal symptoms, then we have to go through and counsel with you. Do you really want to take estrogen? Is it worth it to you? And there are pros and cons in whether or not you're going to take estrogen replacement therapy. The pros are estrogen in and of itself will help with the hot flashes, help with the night sweats, a lot of times help with the mood swings, help sleeping, okay? If you're having decreased sex drive, sometimes it will help with that. The cons are, we know there's a slight increased risk of blood clot, stroke, and it doesn't actually cause breast cancer, but most breast cancers are estrogen receptor positive. So if you were to develop a breast cancer, it might grow more rapidly if you are on estrogen replacement therapy. Now, women who still have a uterus, if they take estrogen and take estrogen alone, the estrogen is going to build up the lining of the uterus. And if it builds the lining of the uterus too much, then you can develop endometrial cancer. So estrogen and endometrial cancer are the only cancer we know it actually causes. So women who still have a uterus, we give them progesterone. So it's an estrogen and progesterone combination. That progesterone is going to either diminish that endometrial lining or slough that endometrial lining, so there is not an increased risk of endometrial cancer. Now, if you've had a hysterectomy or you don't have a uterus anymore, then you can take estrogen by itself, and there's no need for the progesterone. But if you have not had a hysterectomy, then you need to take both hormones. So it's called estrogen progesterone therapy or hormone replacement therapy. That's the two, estrogen and progesterone combined. Or if you've had a hysterectomy, you only take the estrogen. One of the other side benefits of estrogen replacement therapy is that it's beneficial for your hair and for your skin, and helps prevent vaginal atrophy. So when we talk about this, some women want to be on estrogen forever because they think that it's going to help them look younger. And in some ways it does, because estrogen actually promotes collagen. So the collagen, there's a big rage now. Everybody's taking collagen or drinking collagen or whatever they're doing with collagen. But estrogen actually, and some women actually use estrogen cream on their skin. Estrogen actually does promote collagen. And so when women go through menopause, a lot of times they will experience some hair loss. Their hair starts thinning, and their skin will start to kind of sag or get droopier, you'll get more wrinkles, and that's because of a loss of collagen with menopause. If you're on estrogen replacement therapy or you're taking estrogen, then that does deter it to some degree. I mean, it's not going to prevent aging, quote unquote, but it does help more than just not being on any estrogen whatsoever. One of the problems that we see as women age is that they will lose a lot of the collagen in the vagina. So not only do you lose collagen in your face, but you'll also lose collagen in the vagina. And so for some women, this is not a major issue, but for other women, as they lose that collagen in the vagina, then they'll end up with what's called vaginal atrophy. So one of the treatments for vaginal atrophy is to use estrogen locally in the vagina. Some women decide not to use any estrogen hormone replacement therapy, but then they'll end up with what we call vaginal atrophy. So vaginal atrophy is where the tissues in the vagina actually thin out. There's not as much collagen. The tissues become dry and painful, and so when they attempt to have intercourse, there's not the elasticity that they're used to, and the tissues can actually shrink, and intercourse becomes painful. They can experience itching. They can experience difficulty with urination or painful urination because of this. And then with the vaginal atrophy, sometimes they'll have more in the way of what's called prolapse, where the bladder will drop, and that's called a cystocele, or they'll have prolapse of the rectum, and that's called a rectocele. So we have all these issues that we deal with as women age. Estrogen locally will help a lot, and so estrogen for local use comes in the form of a cream, a vaginal cream. There are also little pellets. They almost look like little Pez. They come in a little dispenser that you can use in the vagina. There is an estrogen ring that goes in the vagina and can sit there and dispense estrogen for 3 months at a time. So the ring goes and sits in. And all those things will increase the amount of estrogen locally. For women who can't use any estrogen for whatever reason in their vagina, then they can just use some sort of lubrication like Astroglide or different types of lubrication. That will help to some degree, but nothing is as good as using estrogen actually locally in the vagina. Vaginal rejuvenation has become a hot topic in the United States. There are a lot of women concerned about the way their vulva and their vagina appear. And so because of this, they will come in and they will want a labiaplasty. They think that their labia are too long. Their labia get in the way when they are exercising. They want their labia to look like a very young labia, not to hang down. So they will ask for a labial reduction. Sometimes labial reductions will be covered by insurance if indeed the labia are either one labia is much longer than the other, or the labia actually do interfere with them being able to exercise or have intercourse comfortably. A lot of times the labial reduction is purely a plastic surgery type of surgery. So that is a surgery that we do perform. There is also what's called a vaginal rejuvenation for some women who are post-pregnancy. They feel like that their vagina is just very large or cavernous. For other women who are postmenopausal or have had breast cancer and don't use any estrogen, their vagina has gotten very tight and atrophic, like we talked about before, because of a lack of estrogen and collagen, and they don't have the elasticity anymore. So for those women, you can either use laser or what's called radiofrequency to help with their vagina. In our office, we have the radiofrequency, and the radiofrequency and the laser both are pretty comfortable procedures to try and help stimulate the collagen in the vagina to either decrease that cavernous feeling or else to increase just the collagen in the vagina. So the radiofrequency is just a probe like this. This is the probe we use. It's attached to a machine, and the probe here emits the radiofrequency, and it goes in and out of the vagina, emitting that radiofrequency with a gel on it. So it's kind of almost like a sonoprobe that we use. The laser is pretty similar to this, and we do it for about 10 minutes once a month for 3 months, and that will increase the collagen in the vagina. It also increases the vaginal lubrication in women who have a very atrophic vagina, where those tissues have thinned out. In women who are postpartum and feel like their vagina has just kind of become cavernous, it will help to pull that vagina in to some degree. So that's kind of the vaginal rejuvenation. We can also use this probe on the outside of the vaginal lips to kind of shrink those vaginal lips. So there's a lot that can be done. So that's less invasive than doing the surgical labiaplasty that we just talked about. And I've actually had patients who told me that it changed their life. That, you know, they can have intercourse again where they weren't able to have intercourse before, that intercourse is now comfortable for them where they couldn't have intercourse before, that they could either feel or enjoy. So, you know, that's quite the critique. So even though it's expensive, it's worth it to me if my patients say it's changed their life for the better. I think a lot of the reason that women enjoy seeing a female gynecologist is because they feel comfortable talking about sex with us. And we talk a lot about sex. And, you know, one of the things that I'm going to ask when I get to heaven is, how come men's libido stays up till after age 70 and women's starts to really rapidly decline after about age 50? But it's not just that. You know, women, after they have children, they have a lot of issues with sex after children too, because they're listening for that baby in the next room and they're breastfeeding. And I mean, all sorts of things happen to women's bodies after they have a child, after they go through menopause. There are all sorts of different stages of our desire for sex as we go through different stages of our life as women. And men are just men, you know. You see some hot chick, you see a great looking red Porsche. I mean, all sorts of things happen and your testosterone zips up and there you are, you're ready to go. I mean, that is not us. I mean, we're just different creatures. And so men's testosterone will zip up with all sorts of different things. Women, we're listening for the baby to cry. We're trying to multitask 14 different things. We're trying to get the birthday presents ordered and take the kids to the dentist and manage a job and figure out what we're doing for dinner. And then we got menopause, and then, we just had a baby, and then it hurts. I mean, life is so different from a woman's perspective. And so I think part of my goal is to help women see that, number one, it's important to have a sexual relationship. It's been shown that it's important for health, number one, that having a good sexual relationship is important for your overall well-being. I think it's important because that helps to maintain good relationships with our spouses. I think it's important that we realize that you kind of have to turn off all these other things sometimes to get into that mode. And then we do everything we can to make it as comfortable as possible. And then you just have to realize that we're not always going to be there. They're there, we're not there, and we're just, the kind of different Mars and Venus kind of thing. But we can at least talk about it. And I'm all about having that conversation with my patients so that I feel like I can understand where they come from, because I come from the same place. And yet I've managed to maintain a great, healthy relationship with my husband for 50 plus years. So, so I'm trying to help my patients maintain a good sexual relationship with their significant others as well.